Yeah, I think at this point, we've been talking in a number of circumstances about start over. I mean, we do need healthcare reform. I think we need to first focus on cost. There's the two big issues in healthcare reform are cost and access. And the current bills focus almost exclusively on access and say we'll take care of the cost later. I think you have to start with cost. That's the biggest issue for our members. That's the biggest issue for most Americans. Again, most Americans have health insurance through their employers, don't want to lose it. They're anxious about how much it's going to cost in the future. And cost is also an access issue. If you lower the cost, you can make it easier to bring more people into the system. So how do we start to get at costs? I think we'd be supportive of an effort right now to scale back people's aspirations on healthcare reform. Let's start with insurance market reform. There's no reason why there isn't a single national insurance market for there's no reason why small businesses can't pool together for risk. There's a whole range of bad regulatory bureaucratic things that drive up cost in the system. There's also a whole range of things they can do on Medicaid, Medicare reform at a regulatory level. They can just do it tomorrow in terms of how doctors are paid, how hospitals are paid, to start to drive costs down. We would advocate starting with the simpler, smaller things to start to drive the cost down, and that will make the access issue easier going forward.
I can't speak for my party, but I can speak for myself, and my perspective is that we have three choices. The plan that's been offered, that is in conference right now between the House and Senate trying to resolve the differences. We can choose that. We can choose nothing. Or we can choose reasonable reform that the American people can agree to, and that you would get wide bipartisan majorities, not perfect, but wide bipartisan majorities to get done. Well, I'd choose, number one, I'd choose wide bipartisan majorities. Then, second, I would choose nothing. And then third, what they're offering is absolutely horrible. I mean, in my opinion. And it's not horrible from a political perspective. It's horrible from an access to care perspective. It's horrible in the cost and the burden on individuals and small businesses. It's horrible because it takes us in the wrong direction. And so the fact is, these choices are like this. I got to go down to the Charlotte airport and fly to Washington. You're heading up to Boone. So you say, well, I'll give you a ride to Lenore. Right? Well, thanks for the offer, but you're taking me in the wrong direction. Right? And you would think that I was not so bright if I agreed to something that took me in the wrong direction. And you'd be right. But so we have to make sure we have reforms that take us in the right direction. The President said in last year's State of the Union address, we agree on, what he said in September. We agree on 80%. I looked around and said, well, why don't we do that 80% then? When you're talking about being able to buy across state lines, why can't we get a South Carolina insurance plan if it's cheaper and fits your needs? Why can't we buy in Tennessee? Why don't we have association health plans where Danny can say, I represent these thousands of individuals in our community and go negotiate with Blue Cross Blue Shield? Why do we essentially have a monopoly by one insurance provider here in North Carolina? And they may be a National Chamber member, but I'll just say this. When you have one option, they set the price. That's not good. That's absolutely bad. We need to put tax incentives for individuals so we can buy and afford to buy health insurance. We can have access to care through community clinics rather than a national health care plan that fines and penalizes you. We can have medical malpractice reform that would save over $50 billion over the next 10 years. That's enough to pay for access to care to those Americans who are truly without care. Not those that are in their 20s that don't think anything's going to happen to them, but those that truly are in need. These things are reasonable. And if you go through that list, being able to buy across state lines, medical malpractice reform, eliminating the discrimination against a pre-existing condition, all these things you can get a huge bipartisan majority. Now, it won't be a public option, and it won't be a single-payer system, and it won't be any of these far-reaching things, or it won't be, in the other perspective, a completely free market system. But I think it's something reasonable the American people can support. I think you're right. We have to have health care reform, but this whole process has made it bad. It needs to be in the open. We need to have real discussions, and we need to have the American people engaged on what is reasonable. And I think the fact is a smaller, more pared-down health care bill that focuses just on key issues, cost containment and access to care, will be a huge move in the right direction. And will at least take us down to maybe the Catawba-Lincoln County line on my way to Charlotte.
We want to thank our panel. We want to thank the Hickory Daily Record for their wonderful coverage with this, and our Chairman's Circle sponsors that you see in your program. We've got members of the Board of Directors that have personally and professionally given to support this. Pat Appleson, you have done an incredible job with these videos, and we appreciate you so much. Alan Jackson Group helped with some of these videos, and we appreciate that. The Salt Block Auditorium and their staff. This facility and this salt block is something to be proud of. Would you go visit and walk through here before you leave? Particularly the Science Center, the Museum of Art. There is a exhibit now called Torn from Home, My Life as a Refugee, on the second floor of the Coe Gallery. It is free. Please stop off there on your way out. And we thank you this morning. We appreciate you being here, and support free enterprise, support your chamber, support this economic stability plan, and the leadership that we've got here in this community. Thank you all.